Hello and welcome to Middlesex Moments, the radio program and podcast produced by faculty, staff, and students at Middlesex Community College. I'm Steve Minkler, the campus CEO and academic dean, and your host for today's show. And as always, Middlesex Moments comes to you from the radio and television studios in the Center for New Media, located on the main campus of Middlesex Community College here in Middletown. And with me today is my guest, Dr. Andrea Levy, who goes by Andy, who is an associate professor of psychology at Middlesex Community College. Thanks for joining me today.
Thank you for having me.
Now, Andy, you've been with Middlesex now for about 4 years.
Yep.
And maybe tell our listeners a little bit about your academic background, where you went to school, and what were you doing before coming to Middlesex?
Sure. So for my undergraduate degree, I started at Cornell, and I got a degree in an interesting major. It was called Biology and Society. It was half kind of your biological sciences and half kind of bioethics, history of science type courses. And I then went on to get my PhD in psychology and a master's in medical ethics. I'm very interested in the intersection of psychology and medicine, which I think will become more clear as we keep talking. Mm-hmm. And then I did a postdoctoral fellowship in health psychology at Rutgers, and then I joined the faculty at the Harvard School of Public Health, and then moved to the University of St. Joseph, where I started in their psychology department, and now I'm here for 4 years, as you said.
And we're very glad to have you here.
I'm happy to be here.
So what first got you interested in either of these fields? I mean, both psychology and medical ethics are, I guess to the layman, would seem like very different, discrete topics, but was there something in your schooling or in your background that got you interested in these?
Yeah, so as an undergrad, I worked at the Center for Bioethics at Penn, and when I looked around the center, there were a lot of philosophers and there were physicians who all kind of took their own angle and approach to medical ethical dilemmas. But it occurred to me that there was very little in the way of social science support and research to speak to and shed light on some of these ethical dilemmas that we face. So, for instance, there was one big ethical dilemma where there was this gentleman who had gotten a liver transplant, and his transplant was failing because he wasn't taking his immunosuppressant medications. And the big dilemma was, do we put him back on the transplant list, knowing that he's probably still not going to take his immunosuppressants, and now you're kind of wasting an organ that someone else could benefit from. And so there was this big debate, a big philosophical debate, what do you do? And when someone finally talked to the guy, they learned that he wasn't taking his immunosuppressants because he'd rather put food on the table for his children, right? So situations like that kind of helped me to see that a psychological perspective, as well as evidence, would really add a lot to these kinds of situations. And so that's why I pursued the joint degree in psychology and medical ethics.
Okay. Well, and from a really broad layman's view as well, I would see that this is the intersection between the science of medicine and how the body works and the physiology with the really human social part of it.
Absolutely. And more and more, there's a lot of discussion and research on the mind-body connection, so that I think the connection between the two fields is only growing. Mm-hmm.
And we'll talk in a few minutes about a study that you recently completed, but you have published in a number of journals in your career on this topic. And is there any kind of thread that you find the most intriguing for you professionally?
Yeah, so my focus has always been on issues related to doctor-patient communication. I feel very strongly about patients having the autonomy to make their own medical decisions. And in order to do that, patients need to be able to fully understand their situation, their medical situation, but that's obviously difficult, and doctor-patient communication is just ridden with potential problems and challenges, and so my research has generally focused on that and issues on the patient side in terms of understanding and comprehending and biases that might affect those things.
Well, we'll explore a lot more about that after a short break. And when we come back, more with Dr. Andrea Levy from Middlesex Community College and Department of Psychology. You're listening to Middlesex Moments from Middlesex Community College. Stay tuned. Welcome back to Middlesex Moments, coming to you from Middlesex Community College. This is Steve Minkler, together with my guest, Dr. Andrea Levy, who's the Associate Professor of Psychology here at the college. And we were talking about Dr. Levy's interest in bioethics and psychology and the intersection of science with the very human elements of medicine. And actually, Dr. Levy and colleagues recently published a study that kind of focuses on the subject of why patients lie to their doctors. It's got a rather long title, but I think I'll toss it over to Andy to tell us a little bit more about this study.
So we pursued this line of research because it's really important that doctors have accurate information from patients so that they can make accurate diagnoses and appropriate recommendations. Yet we know that people tend to withhold information from others, and we know that they're especially likely to do this when it pertains to some sort of sensitive information. And it just so happens that the things that patients and doctors talk about are often rather uncomfortable, and so it can be really hard to tell your doctor some things. Patients want their doctors to like them, they don't want to be embarrassed, they don't want to be judged, and so it became clear that it was a real concern that patients might be regularly withholding important information from their clinicians, and so we decided to pursue this and explore it.
And this kind of information could run from what seems like rather ordinary things, like I had my physical recently, my doctor asks me, "Are you exercising more?" And I said, "Sure I am." A little bit of a fib. But I think that even though exercise and movement is good for your health, I think you're talking about information that could be much more critical to perhaps an immediate diagnosis of something that's a lot more serious health problem.
So we're really looking at both. So this first study that was recently published was looking at kind of more benign, mundane things like withholding information about lack of exercise and unhealthy diet and taking a certain medication, even withholding information about taking someone else's prescription medication. Additional work that we're doing is looking at some more sensitive matters like withholding information about suicidality or depression or sexual assault and abuse. But this first study did focus on those more mundane things like exercise and diet and understanding the providers, the clinicians' instructions and things of that sort.
Mm-hmm. So just for our listeners' benefit, the actual title of this article is "The Prevalence of and Factors Associated with Patient Non-Disclosure of Medically Relevant Information to Clinicians." And this was a national study that you conducted with colleagues at the University of Utah Health System, correct?
And University of Michigan, yes.
Okay. Now, how did you get connected with them?
These are colleagues that I connected with at professional conferences over the years, and we have very common interests, and makes for a good, nice collaboration.
Okay. And together you found that there is a significant prevalence of non-disclosure. And so you surveyed over 2,000 people from across the United States.
So there was actually two studies for a total of 4,500 subjects, yeah.
Okay. And how was this information collected?
So we ran 2 online surveys in which we asked people if they had ever withheld from a clinician information about, and we had a variety of different types of information like lack of exercise, like unhealthy diet. And then those who said, yes, I have withheld this information from a clinician were then routed to a web page that asked them their reasons for withholding this information, such as being embarrassed, such as not wanting to be a difficult patient, such as not wanting to be judged or lectured.
Mm-hmm. And what were some of the findings of the study that you were able to draw from the surveys that you received?
So what we found was that most people withheld at least one of the 7 types that we focused on in this particular article, one of the 7 types of information from their clinician. In one of the studies, it was 81%, in another one, it was 61%. The type of information that was most commonly withheld was not understanding the clinician's instructions and disagreeing with the clinician's recommendation, which I found interesting because that's pretty benign, right? Of the type of information that patients have to talk to their clinicians about, that's pretty low on the embarrassment and discomfort scale. And yet that's what was most common among the items that we looked at. And then in terms of why they did this, the most commonly endorsed reasons were, again, not wanting to be embarrassed, not wanting to be judged or lectured. A lot of people said that they didn't want to have to make a difficult change, like starting to exercise, that would then come out of a discussion about the fact that they don't exercise. And then another main result that was important was that it was women and younger people and the sicker patients who were most likely to withhold information from their clinician, which seems really important because it's the sickest patients, of course, who have the most complex medical situations where it's really most essential for the clinician to have accurate information. And so that was especially concerning.
Mm-hmm. Did you share the results of this study with some physicians just to get their feedback from the results that you obtained?
Yeah, I think physicians on some level this is like somewhat of a conventional wisdom in the medical field. I think the philosophy is that if you ask a patient how much they drink, that you have to double that to get an accurate an accurate picture of what's going on. But I'm not sure that clinicians had a sense of how common this is, and also this provided more insight into what are the reasons behind it, which is of course important for taking measures to combat it.
Right. Now, do you think that clinicians may fall into a trap that many people do? They are experts in their area, and then when it comes to education, patient education, that because as a physician you're surrounded by it all the time, you almost take it for granted that everybody I talk to knows about this. Were there any recommendations around better patient education or perhaps use of vocabulary among clinicians to make sure the communication was clearer?
Yeah, so there's a lot of research showing that clinicians use terminology, jargon terms that patients do not understand. There's actually even a study that showed that clinicians use jargon terms that they know patients don't understand, and we could speculate as to why they might do that, maybe to expedite the process or things of the sort. But there's certainly always more work to be done in terms of patient education. But the onus is not just on the provider. The onus is also on the patient. And there's a lot of strategies patients can use, like asking permission to record the encounter, because it's so easy, especially in high-stress situations, which medical situations often are, to forget this complex information that you've been given. But it's really important and that patients be willing to take the risk of being embarrassed or being uncomfortable. And all of the authors on this paper are patients themselves. And we, of course, understand that there are things that are really hard to speak up about to your provider, especially when it comes to sensitive or embarrassing things. But what's important is that we also remember the flip side of that, which is the potential consequences of not disclosing. So it can truly compromise a patient's medical care and therefore their health to not disclose medically relevant information to a provider. So, for instance, if a patient doesn't disclose that they take a certain medication, the provider could then prescribe a medication that is dangerous in conjunction with that medication that's not mentioned. And there's so many different scenarios like that can arise. And that's where this becomes really concerning.
Did you find, you mentioned one scenario where a patient was non-compliant with medication because they needed to use the money to put food on the table. So I would imagine this is also an intersection of the world of insurance and economics as well, not just a conscious decision to ignore a doctor's advice. Did any of that, anything else like that seep into this study or in previous studies that you've done?
In this study, it did to the extent that people mentioned not wanting information in their medical record as a reason for not disclosing. And there's all sorts of different concerns around information being disclosed, being available to third parties, be it insurers or employers. Some of those are somewhat conspiracy theory based, and some of them are more legitimate. But that definitely has a place here.
Okay. Before we go to break, I think if you had to come away with an essential talking point to our listeners is that listen to your body and talk to your doctor.
Right.
And listen carefully.
That sounds good.
Okay. Well, after a short break, we'll be back with Dr. Andrea Levy here on Middlesex Moments, coming to you from Middlesex Community College. Stay tuned.
Starting back in high school, I was not the best student. It wasn't that I was not able to do the work, it was just that I had no motivation to do work. And so I decided that Middlesex was the best option for me. You have a lot of support here. I had professors that cared about me, that pushed me in ways. I went to Middlesex Community College and transferred to Wesleyan University with a full scholarship, and it's all because I did well at Middlesex.
Middlesex Community College is your college, your future. Welcome back to Middlesex Moments, coming to you from Middlesex Community College. This is Steve Menkler, together with my guest, Dr. Andrea Levy, Associate Professor of Psychology here at the college. And before the break, we were talking about Dr. Levy's study that she conducted with colleagues from around the country, which surveyed over 4,000 people about their communication with their doctors and the amount of information that they possibly withhold from their doctors, such as, sure, I exercise more, or, intentional miscommunication. So we talked before the break about sort of the general profile of the kind of patient who might be non-disclosing information. So what are some of the next steps from this study? Any recommendations, or are there future studies that you're planning from what you've done?
Absolutely. So there are a few different things we want to focus on next. The first is looking at some of the more sensitive topics that patients might withhold from their clinicians, like suicidality and depression and abuse and things of that nature that we might imagine would be particularly difficult to disclose, and yet particularly important to disclose, because in many of those cases we're talking about imminent threats that patients might face. So that's one really important next step. We also want to try to better understand this phenomenon in the sense of to what degree are patients distorting the truth. There's a big difference between someone who doesn't exercise at all saying, yeah, I exercise once in a while, and someone who doesn't exercise at all saying, oh, yes, I exercise vigorously 5 times a week, right? So we want to get a better handle on the degree of the lie, if you will, which this study really could not get at, just for the sake of kind of reducing respondent burden. And then most importantly, we want to explore interventions for trying to correct this. What can we do to help patients become more comfortable disclosing things that they might feel are embarrassing or shameful to their clinicians? Again, because there are some very real consequences to not sharing this information. And as with any relationship, we feel that this is going to require effort on both sides, both the clinician and the patient. On the part of the clinician, is it a matter of making better eye contact? Is it a matter of asking hard questions? Is it a matter of maybe normalizing for the patient? Hey, the last person I saw, they said they were having a real hard trouble with erectile dysfunction. Have you ever had a problem with that? So that might make it easier for a patient to disclose embarrassing information. And then on the part of the patient, there probably needs to be some work at educating patients about some of the real consequences of withholding this kind of information.
Yeah, so it would seem that one possible recommendation coming out of this is better patient education and better doctor education, clinician education. And as you said earlier, some of this, when you did bring this to the attention of clinicians, you said it was conventional wisdom. They kind of know this in some respect, but like you were saying, are there clues? Are there nonverbal cues, or perhaps certain key words that they should have their antennas up for to be a little more probative when they're talking with their patients?
Right, and those are the questions that we need to explore more.
Yeah, and I would think for patient education, I mean, it could be something as simple as something, I don't know, in the waiting room, you're sitting there waiting to, go see your doctor. Perhaps it's a poster that's stretching the comparison here a little bit, but the say something, see something kind of an idea. And if you feel something, say something.
I like that, yeah.
So maybe that's my communication
Thank
background
you.
helping you out.
Thank you for your contribution.
All right. Well, so you were really fortunate to have connected with these colleagues at other institutions whom you've met at conferences and just, had a mutual interest in this topic,
Yep.
which gets you out there as someone who has an interest in research. Now, here at Middlesex Community College, we are a teaching institution. So how do you keep that research interest alive in you as a professional, and how do you connect your Middlesex Community College students to really the exciting world of doing research?
So in my classes, I focus very heavily on research and the importance of research and why we can't just rely on our own everyday observations, and that's namely because there's all sorts of biases that play into them. And so I spend a lot of time talking about that in my classes. And in a sense, I become like a voice in my students' heads where no Google, do not use Google, right? You need research, you need objective, systematic evidence if you're going to be able to trust the information. But we also I also try to put kind of my money where my mouth is, and have this play out in the form of our annual research fair. So we call it an academic convivium. It's held every April on campus, and it's an opportunity for students to showcase their research, whether it be in oral or poster presentations, just like they would if they attended a professional conference. And they have the opportunity to teach our community about different topics, and our community members have the opportunity to learn about a wide variety of topics and to share in this very professional academic environment.
Mm-hmm. And the fact is, you chair that event, or you coordinate the event on behalf of the college. And in a given year, we typically have between 40 and 50 students from all different majors at the college making presentations.
We do. Yeah, it's a very nice variety of topics that are addressed, which is an opportunity even for faculty and administration to learn about things they wouldn't have the opportunity to learn.
Sure. What's some advice that you give to students who may have, if you will, convivium quality work under their belt, but maybe reluctant to present it? Is there some incentive that they have if they're thinking about future education beyond Middlesex to be involved with research and events like the convivium?
Sure. It's certainly a really valuable experience to have the opportunity to stand up in front of a group and, well, first of all, prepare a presentation to be worthy of presenting in front of a group, and then to have the experience of doing so. It also really shows future institutions or future employers that this person stands out in some important ways and has done important work and has been willing to kind of take the risk of putting it out there, and has had that really valuable experience. Mm-hmm. So I encourage students to do this because I think it's very beneficial to them. I think it's very beneficial to our community, and it can certainly serve them going forward.
Okay. And for our listeners, this would be the 5th annual convivium coming up this year.
Yes.
So we've recorded many of the convivium presentations the last 4 years, and if you go over to YouTube on your computer, you could probably find a couple. If you search for MXCC Convivium, you're likely to find a few. So as we kind of wind down our discussion, I think I'd like to also let our listeners know that Dr. Levy is involved in our honors program, but also coordinates our psychology studies program. And for people who may not be familiar, this is one of these new TAP transfer degrees. And could you explain this a little bit?
Sure. So students who complete an associate's degree in psychology studies at Middlesex, which is made up of half of general education requirements, and then the remaining half is various psychology courses. Upon completing the associate's degree here, they have the opportunity to transfer to any of the state universities and are essentially guaranteed enrollment as a first semester junior, and with the thinking that they can then have the opportunity to graduate with their bachelor's degree in 2 years. And so now they have completed that full bachelor's degree in the total of 4 years, assuming they're full-time here.
Mm-hmm. That's significant savings because the community colleges are a real bargain, relatively speaking.
Indeed.
And I think, and then actually the psychology studies program is one of the most rapidly growing programs at our college.
It is growing
which
very
is great.
quickly.
So you've been a busy person.
I have.
So I think just to kind of wrap things up, again, for our listeners, when you see your doctor, speak honestly and speak openly with your doctor, right?
They've probably heard and seen worse
There you
than
go.
whatever you have to tell them.
Right. And it's always good to do your research as a patient, as a doctor, but more importantly as a college student and a professional in psychology and bioethics. So
Absolutely.
keep in touch with your research self, and this is something we emphasize here at Middlesex Community College. So we invite you to come learn more about that at our academic convivium online on YouTube, or this year, which is the date?
April 26th.
April 26th, and it's really all day.
It's an all-day event in
Yep.
Founders Hall.
And we usually have some snacks and lunch here, so it is an open public event. So we
It is.
invite everybody to come for that. Well, I really want to thank Dr. Andrea Levy for joining me today. Thanks for being with me.
Thank you for having me.
And thanks to you, our listeners, for joining us for another edition of Middlesex Moments. As always, you're welcome to visit us in person at our main campus located at 100 Training Hill Road in Middletown, or at our Meriden Center located at Platt High School, 220 Coe Avenue, where we offer afternoon and evening classes 4 days a week. And of course, you can visit us online 24/7 at mxcc.edu. From Middlesex Community College, I'm Stephen Minkler, and we hope to see you again soon.